Hi, good afternoon, everybody. We're so pleased that you have joined us for the DNPAO seminar series. This seminar will focus on new data on added sugar intake in the U.S. and the impact of community actions to reduce added sugars. So glad that you could join us. Afterwards, this webinar will eventually be posted to the DNPAO website. So if you've missed some of our past webinars, you can go there to find previous ones. And I'm Janelle Gunn. I'm here to moderate our webinar today. We have a really great panel today. I think you'll hear a lot of great information and get some good resources and things to use. So just a few housekeeping items as we get started with the webinar. So this is a Zoom webinar. It's going to be recorded. And so if you're not comfortable with it being recorded, we ask that you disconnect at this time. To have the best experience, we encourage you to use your Zoom webinar app or website to view the slides and to participate in today's meeting. All participants are muted. Following our 3 presentations, we will have a question and answer session. So the Q&A box is open, so feel free at any time to go ahead and insert any questions that you have. We'll be loading them in and getting ready to respond. And then also at the end, there'll be time as well. So let's go ahead and get started. So why is CDC having a webinar on added sugar? Well, our division focuses on nutrition, physical activity, and obesity here at CDC, and we really are helping Americans eat healthy and be physically active through their lifespan. And through the nutrition component, we really focused on how can we help Americans eat consistent with the dietary guidelines for Americans. And this is in the last iteration of the dietary guidelines. This is the first time we saw a specific recommendation for added sugars for young children. And in the last 2 editions, there has been one for the general population. So the dietary guidelines has the recommendation to consume less than 10% of calories per day starting at the age of 2. And then for children under 2, they recommend to avoid foods and beverages with added sugars. Also of interest is that added sugars, or reducing added sugars, is a leading health indicator for the Healthy People 2030 initiative. And if you're familiar with Healthy People, it sets national goals to help us sort of target our efforts. And a leading health indicator is one that's been prioritized because of its potential large impact on health. So this was elevated in this last iteration as an area that could have a lot of impact on health. So we've been doing some work in this area. Hopefully you've seen some of our recent articles that we have on added sugars. We put them in here, also the references in case that you want to find them. And also want to share some other work we've been doing on communications as well. So you can see on the bottom here, there's an infographic. I did just a couple of screenshots of the infographic. It's not the whole infographic here. There's a link in the chat box if you want to check it out. But ways that we've been sort of focusing our efforts on added sugars. The second image I selected here I thought was a great one because it really helps show how added sugars might fit into your broader nutrition work, and it fits into the nutrition standards work. So we have efforts in the early care and education setting and in food service guidelines, and added sugars can be a component of those efforts. So be sure to check out the infographic. We've also been doing some communications, like we call it a micro campaign, so a little bit of work on raising awareness on added sugars. We've revived the Rethink Your Drink campaign to do this. We've been doing some digital testing of messaging related to Rethink Your Drink, focusing on some of the negative health consequences, but also choosing water and other beverages. And then we've been kind of testing these in real time. We did some Google ad buys and other things to see the response. Here's some examples of some of the digital ads we've been using, and we've really been learning in time and updating based on what we're hearing from people in terms of what's resonating, what kind of imagery is resonating. And then we link these to our Rethink Your Drink webpage, so feel free to check that out as well. That has some broader information on reducing added sugars. So these ads can be found in our State and Community Health Media Center. There's a web address there. These ads, along with lots of other great ads, can be found there. These are either free or low cost, so the ones that CDC produces are free. They're audience tested and have supporting materials in English and other languages. We uploaded some great new photos that could be used for your work beyond added sugars, but great new diverse imagery too there. So if you're not already part of the State and Community Health Media Center, log in and join and have some access to those things. Also, you'll hear from Alaska later today, and they have some of their materials in the Media Center, so a great resource for you all. Also, just want to note that DNPAO has a set of multimedia tools, infographics, badges, audio, etc. So there's a URL for that as well. Let's get to the real purpose for today. We have a really great panel. I'm excited about our panel today and the information that they have to share with you. So I'm going to do a little introduction now, and then we're just going to keep moving and not stop in between. And then we'll finish with some Q&A. So first, I'm pleased to have Dr. Sung-Yoon Park joining us. She is my colleague at DNPAO. She's been with DNPAO since 2009. She's a lead epidemiologist, and she's contributed to a wealth of expertise and experience in the areas of added sugar, sugar-sweetened beverages, drinking water, and obesity. Dr. Park has authored more than 130 peer-reviewed manuscripts, 4 reports, 2 book chapters, and 126 abstracts. And she's an author, I think, on most of those articles I shared with you on the previous slide. Next, super excited to be joined by Dr. Fran Fleming. She is the Director of Marketing Initiatives at the Rudd Center for Food Policy and Health at the University of Connecticut. Her work focuses on analyzing the amount, type, and nutrition of foods and beverages marketed to children, adolescents, and parents of young children. She also determines the effects of exposure of food marketing and examines racial and ethnic differences in rates and exposure and the impact of targeted marketing practices. And then lastly, we'll hear a great presentation from our colleague Ann Potempa. She's the Chronic Disease Communications Team Lead in the Alaska Department of Public Health. She has focused her career on health communication and education for more than 20 years. She started and continues to manage the state's 10-year-old Play Everyday social marketing campaign, which promotes increased opportunities for daily physical activity and decreased consumption of added sugars. In addition, Ms. Potempa provides public health social marketing and health communication consultation to agencies and partners nationally and internationally. So you can see we have a great panel today. Excited to get started with our panel. And for that, I would like to now turn it over to my colleague, Dr. Sung-Yoon Park.
Thank you, Janelle. Good afternoon. Thanks for giving me this opportunity to share our work on sugar-sweetened beverage. Some examples of added sugars include, but not limited to, sucrose, dextrose, table sugars, syrups, honey, and sugars from concentrate. Adverse health consequences associated with eating and drinking too much added sugars include obesity, type 2 diabetes, cardiovascular disease, and dental caries. Sugar-sweetened beverage, also known as SSB, are liquids sweetened with various forms of added sugars that add calories, such as regular soda, fruit drinks, sweetened coffee, and tea drinks, and sports and energy drinks. SSBs are the leading sources of added sugars in the American diet. Today, I'm going to share 3 recent studies that we published on added sugars and sugar-sweetened beverages. For the first study, we examined characteristics of U.S. children and adolescents who reported high intake of added sugars and eating occasions and top sources of added sugars that contributed to intakes among high consumers. We used the National Health and Nutrition Examination Survey data from 2015 to 2018 among over 5,200 youth aged 2 to 19 years. In this study, we defined high consumers as consuming greater than 15% of total daily calorie intake from added sugars. So this is 1.5 times higher than 2020 to 2025 dietary guidelines for Americans recommendations, which is less than 10% of total daily calorie intake. Variables of interest were selected socio-demographic characteristics of youth and household. In result, we found that overall, 34.4% of youth were classified as high consumers. When we look at by characteristics, the prevalence of high consumers was significantly higher among older children, non-Hispanic Black or white children, and children with head of household education of high school or some college compared to their counterparts. By eating occasions among high consumers, 41% of added sugars were consumed during snack occasions, followed by dinner time, 23%, lunchtime, 20%, and breakfast time, 17%. And here are 5 leading sources of added sugars, which together providing about 80% of added sugars among high consumers on a given day. 43% of the contribution came from sweetened beverages, followed by 15% from sweet bakery products, 9% from candy, 7% from other desserts, and 5% from ready-to-eat cereals. For the second studies, we examined characteristics of U.S. adults who reported high intakes of added sugars and the eating occasions and top sources of added sugars that contributed to intakes among high consumers. We used National Health and Nutrition Examination Survey data from 2015 to 2018 among over 9,600 adults aged 20 years and older. Same as the children's study, we defined high consumers as consuming greater than 15% of total daily calorie intake from added sugars. Variables of interest were selected socio-demographic characteristics of adults and household. In the result, we found that overall about 30% of adults were classified as high consumers. When we look at by characteristics, the prevalence of high consumers was significantly higher among younger adults, non-Hispanic Black or white adults, adults with lower education level, as well as adults who were not married or those with lower incomes compared to their counterparts. By eating occasions among high consumers of added sugars, the contribution of energy intake from added sugar was the highest during snack occasions, 43%, and followed by dinner time, 24%, and lunchtime, 19%, and breakfast time, which was 15% on a given day. Here are the top 5 leading sources of added sugars, which together providing about 76% of added sugars among high consumers on a given day. 42% of the contribution came from sweetened beverage, followed by 12% from tea, 11% from sweet bakery products, 7% from jams, syrups, sugars, and 5% from candy. For the third study, we estimated dietary intake of added sugars by 50 states and DC, and also examined the factors associated with added sugar intake among US adults. To increase the sample size, we combined 2010 and 2015 National Health Interview Survey cancer control supplement, which had dietary intake data among over 52,000 adults. Using 9 questions on beverages and food with added sugars, dietary added sugar intakes were estimated. Explanatory measures were selected socio-demographic characteristics, census regions, and states. Overall, the estimated mean dietary intake of added sugar was 17 teaspoons per day among US adults in 2010 and 2015. Estimated added sugar intake varied by socio-demographic characteristics. For example, mean added sugar intake was significantly higher among younger adults, male, non-Hispanic Black, or Hispanic adults, those who were not married, adults with lower education or lower household income, those living in the non-metropolitan, and adults living in Northeast, Midwest, or South compared to their counterparts. For the first time, we were able to report added sugar intake for all 50 states and DC. As shown in this map, estimated added sugar intake varied by states and ranged from 14.8 teaspoons per day in Alaska to 21.2 teaspoons per day in Kentucky. That concludes my presentation, and thank you for your time. Now I will turn it over to Dr. Franz Fleming.
Thank you, So-Yeon. Hi, my name is Dr. Fran Fleming Malici, and I am from the Rudd Center for Food Policy and Health. I'm going to talk to you today about sugary drink marketing to children and parents of young children. So first, I'm going to talk about why we study sugary drink marketing to young children. Research conducted at the Rudd Center and by many other researchers has concluded that marketing sugary drinks to young children influences their attitudes and preferences for the drinks that are marketed. And it also increases what we call pester power. If anyone has spent any time with a child and unhealthy food in the area, they know what I'm talking about. When a child sees marketing for an unhealthy product, it's determined that this is something that really influences pestering adults for purchasing of it or for wanting it. And then finally, we know that marketing also influences consumption of sugary drinks that are available and also has effects on longer term consumption. So the following images on the slides are examples. I just wanted to note that. So how are children exposed to sugary drink marketing? So many of us think about advertising on TV as a major, contributor. We think about advertising, we think of TV ads, but that's just one way kids are exposed to marketing of sugary drinks. Now, a lot of us as adults and also children are spending a lot of time on other screens, and unhealthy sugary drinks are marketed to children in that space. They are also marketed to children in other ways, including store displays on the front of package of products that you'll see in the supermarket, outside advertising, and then at events that are for families, such as parades or concerts. When we've studied sugary drink marketing recently, and in a report that I'm about to talk about, we focused on two categories of drinks marketed to young children: sweetened drinks, and they include flavored waters, fruit drinks, and drink mixes, and unsweetened drinks. And these are the 100% juice products, and also the newer products that are on the market that are a blend of juice and water. So in this report, we looked at the sales, nutrition, and marketing of these drinks. And we found that when we look at sugary drink sales, really the vast majority of sales, 62%, are for sweetened children's drinks. That's fruit drinks and flavored waters, less on unsweetened. And then when we look at the nutrition, we find that 65% contain added sugars. And many also contained what we call diet sweeteners, which is something that is a term that's not the most popular term, but certainly non-nutritive sweeteners is something that we use as researchers, but it's not something that comes to mind when other people are thinking about these sweeteners. And these include natural sweeteners such as stevia leaf extract, or monk fruit, or also sucralose and other things like that, low-calorie sweeteners. So a lot of children's drinks contained these diet sweeteners, and we were really surprised about that in our research. We also found that most of the products contained images of fruit on the packaging, but only 35% contained any juice at all. And then the sweetened drinks that we studied, a third of them contained 4 or more teaspoons of added sugar. And when we look at the exposure just on TV alone, we found that children saw 2 times as many ads for the sweetened drinks as they did for drinks without added sweeteners. And for these sweetened drinks, they saw 4 times as many ads as adults saw. So these ads on TV are directed to children. More recently, we just studied food and beverages on YouTube channels. This is a space that is really popular for young children to be in now. When we looked at these YouTube made for kids child influencer channels, we found that 4 out of every 10 videos that we examined had branded food or drinks. This is mostly candy, salty snacks, and also sugary drinks and ice cream. And when you look at the numbers for these, it's pretty shocking. these two channels here, you can see the high numbers alone, but taken together, the amount of exposure that children can get by viewing these child influencer videos is really quite high. And the children in these videos are not only showing these products in the background, but they're also interacting with them or consuming them. And we know from other research that that's something that could really influence children even more than just a static placement. And more recently, the past few years, we focused on two categories of sugary drinks that are marketed to parents as appropriate for young children. I call these gateway sugary drinks because they're really the drinks that young children would be most likely to consume first in their lifetime. Neither of these drinks are recommended by child health experts. They're marketed to parents as healthy or necessary, and we know that the marketing influences parents' choices. As Janelle pointed out, children under the age of 2, based on the new DGAs, should not have any added sugar at all. But as I'm about to show you, the products that are marketed to them or marketed to parents as appropriate for them do have added sugar. So fruit drinks are frequently marketed as healthy, as I mentioned earlier, with pictures of fruit or lots of different claims on the front of package about things being natural or healthy or having water as in the term on the front of package that really confuses and misleads parents. And when we've talked to parents in focus groups, we find that these techniques that companies use are really influential. So one parent said that when they see the pictures of fruit on the packaging, you think that the product actually has this in it. And then these products are also cross-branded. And what I mean by cross-branded is that some of them have products that are 100% juice or these diluted juice water blends, but also flavored waters and fruit drinks. And they're all kind of packaged the same as you see here. So one parent talked about looking at the packaging, coming home from the supermarket, and then realizing, oh, this really isn't 100% juice that I purchased, and having to go back and return it. So the marketing creates these misperceptions. We've done a number of studies. Parents have a lot of trouble identifying the ingredients in these drinks and distinguishing between the unsweetened and the sweetened options. Parents have told us they look for real or natural or vitamin C when they're purchasing drinks for their child, but these types of claims are really common on sweetened drinks. And while parents are concerned about diet sweeteners and do not want to give them to their children, they don't recognize that children's drinks contain them. So they misperceive fruit drinks as healthy. And when in the research that we've done, we found that when parents perceive a drink to be healthy for their child, they're more likely to serve it to their child. So this contributes to parents' purchases and serving of a drink. And toddler milks are another category that are marketed to parents. They contain really just powdered milk, added sugar, and vegetable oils, and other vitamins and additives, but they are marketed as the next step after infant formula. And these drinks have more sodium and less protein than plain cow's milk, and they're expensive. They can cost 4 times as much. And giving a child sweetened drinks at this age may increase a child's preference for sweet and then also cause them to dislike the unsweetened drinks that a parent tries to introduce. But if you look at the claims on the packaging, you would never know that these drinks have added sugar or are not appropriate because they're filled with claims. And it makes parents feel as if they need to give these to their child for their child to be healthy. The other issue is that they're put right next to trusted infant formula, and they look very similar. So parents have talked about seeing them on the shelf when their child, a toddler, was a picky eater, which is very common for something like picky eating is a very common thing for a toddler to experience, or for parents to maybe get frustrated by. But these products are marketed as the answer to the problem. And if you look at the packaging, they look very similar to the infant formula. And parents trust these products, the infant formula products, and so that trust can get put right onto the same brand of toddler milk. So again, we found that marketing influences parents' purchases of these products. So the marketing claims mislead parents about the product's benefits. And parents believe that the marketing claims are true, but if you look a little bit further, they're not supported by any type of science. And parents who believed that the marketing claims were, real and believed in them were more likely to serve their toddler milks to their child. And the other issue is that caregivers have provided these to infants. Infant formula is specially formulated for infants' needs, and toddler milk should not be given to infants. But we have done research and found out that that has happened. So we've done a lot of research and there are a lot of efforts around addressing sugary drink marketing that we've done. We've created counter marketing videos to reduce parents' provision of toddler milks and fruit drinks to their young children, and they're available in English and Spanish. We also have filed an FDA citizen petition requesting that the labeling of toddler milks change so that parents understand what these drinks really are. We also have done research to determine what might be best to put on the front of package so that parents know the ingredients that are in the drinks that they're selecting for their children. And we submitted research and comments recently to the FTC. They've been investigating ways to protect kids from stealth marketing on digital media. And we continue to challenge industry with our research. And we examine racial and ethnic targeted marketing to try and get policy changes and company changes. Thank you. I want to thank the team and our funders for being able to fund the research and for all the effort that gets put into the research that I just presented here. And here are the references. And here are links to all of the resources that we have. I believe that they will also be sent to people who are participating in this webinar today. Thanks very much for your time. It's an honor to be here to present to you. Next up, Anne is going to be talking to you.
Thank you so much. My name is Anne Potempa, and I am a public health communications specialist in Alaska. It was great to hear that presentation on sugary drink marketing, and I'm going to be talking about how we use in Alaska social marketing campaigns to promote the opposite, to promote healthy drinks like water and unflavored white milk. So Alaska is a recipient of the CDC's State Physical Activity and Nutrition Grant. And each state that receives this grant has its own unique way of addressing the grant objectives. I'm going to talk today about how Alaska's Physical Activity and Nutrition Program integrated a social marketing campaign called Play Every Day into its work to support the grant objective of improving nutrition for families with preschool-aged children. Play Every Day is an evidence-based campaign with the goal of promoting health behaviors that help Alaska children grow up at a healthy weight. And that's a really important goal in our state, where about 1 out of 3 children is growing up with overweight or obesity. We call Alaska's campaign Play Every Day because it started with the emphasis of increasing opportunities for kids to get closer to the national recommendation for daily physical activity, or as we call it, Play Every Day. In more recent years, we've added messaging focused on reducing sugary drink consumption among children and promoting water or white milk instead. Today, I'm going to discuss an evaluation that showed Alaska's mothers changed the drinks they serve their families because of our Play Every Day campaign. I'm proud to say that I helped launch Play Every Day more than 10 years ago with our state's Physical Activity and Nutrition Program manager, and it's been running continuously since then. We've been able to accomplish that by using innovative partnerships and by braiding multiple funding sources that include federal grants across various health programs. Twice during the past decade, we've completed evaluations that show the campaign is reaching our priority audience, improving knowledge about drinks, and positively changing behaviors that are related to nutrition. Today, I'm going to focus on our most recent evaluation that showed how the Play Every Day campaign reached a priority group of Alaska parents to motivate serving fewer sugary drinks to their young children. As a social marketing campaign, we follow key steps. We use research to inform and to evaluate our work. We hold focus groups with parents in our priority audience, including those who say they regularly serve sugary drinks to their young children. We use those groups to better understand parents' knowledge, attitudes, and behaviors, and we also use them to test messages before we finalize them. Play Every Day shares motivating messages in many ways. This includes working with key partners, including childcare and preschool providers, healthcare providers, and a nonprofit tribal organization providing healthcare services for Alaska Native families. It includes reaching parents wherever they are. That includes paid placement of messages through short public service announcements on TV, through websites and social media, and on print materials that are really easy for us in Alaska to mail and distribute to remote rural parts of our state. It also includes writing blogs and sharing them through listservs that can reach thousands of families each time. It includes earned media, which means working with things like newspapers, TV, and radio stations to get articles published. This slide shows a recently published article that featured our campaign evaluation. A number of times during the past decade, we've tested messages with our priority audience before we made them. We want to make sure we're creating messages that speak to the audience and spark motivation to change. One message that resonated with Alaska parents was this one that uses social math. It uses a simple visual comparison to show that a small sweetened fruit drink can have as much sugar as 8 powdered mini donuts. A little Alaska Native girl in this PSA stacks those donuts, showing that the stack reaches higher than the top of the drink bottle. I don't have time to show this right now, so I've included the link to this video at the bottom. You can also find our campaign's YouTube channel at youtube.com/playeverydayak. I'll have links on the last slide. It's important to evaluate social marketing campaigns like Play Every Day to ensure you're reaching your audience, improving knowledge, and positively changing health behaviors. Evaluations can be expensive, particularly if you plan to create and field a special survey just for campaign evaluation alone. We were successful by using a different, lower cost approach this time. We leveraged our ability to add campaign evaluation questions to a trusted state survey that was already in place. We are including questions on what's called the Alaska Childhood Understanding Behavior Survey, which is abbreviated as CUBS. It's run through our Alaska Division of Public Health. It's a systematic survey with a strong history in the state, and it's a great match for our campaign. Our current materials are geared toward Alaska parents with preschoolers at home. This survey is filled out by Alaska mothers of 3-year-old children. We know a parent's time and attention is limited, especially on surveys like this that have established sets of questions. We were able to add about 5 questions to the end. And while small in number, these questions really hit all the key areas we wanted to focus on for campaign evaluation. Did our messages reach our audience? Did they give parents new information about drinks they serve their kids? Did parents talk about and share these messages with others? And ultimately, did our messages change what drinks parents served their young children? We added our survey questions in early 2020, and they will remain on the survey through this year. The results on this slide are from our first year of analysis, and at that point, we analyzed responses from 476 Alaska mothers. The analysis showed that many families were seeing and hearing the Play Every Day campaign. 34% of Alaska mothers had seen the campaign about sugary drinks in the past 12 months. Many parents who had seen it had positive responses. Among those who saw the campaign, 39% said it gave them new information about drinks they serve. 43% said they talked about or shared these messages with others. And 21% said they changed the drinks they served their 3-year-old children because of the campaign messages. That's 1 out of 5 Alaska parents seeing the campaign and changing the drinks they serve because of the messages. And that's really the ultimate goal of the campaign, to positively change nutrition behaviors among Alaska families with young children. It's been our goal to publish results from our social marketing campaign to improve nutrition among Alaska's families. And we did that this fall through a special supplement of the peer-reviewed Health Promotion Practice Journal. Our findings in this journal are definitely written in a scientific style. So I wanted to make sure that we were also sharing those findings in more everyday words with the Alaskans we serve. I rewrote those results in a blog that we published on our Play Every Day website. We shared that statewide through an email listserv that is free, and it was opened by more than 12,500 people. We also recorded and shared our results through a podcast, and links to all of those are on this slide. It's also our priority to share our Play Everyday materials with other public health agencies across the country at no cost to them. Over the past few years, we've submitted many videos and related messages to the CDC State and Community Health Media Center. That center is an online library for all types of materials that relate to physical activity, nutrition, and chronic disease prevention and management. CDC best practices for social marketing campaigns like this one say they are most effective at improving knowledge and behaviors when they are sustained and reach the priority audience with enough frequency over time. We've worked really hard to sustain Play Every Day for more than a decade. Alaska families now recognize the campaign and say they make changes because of it. This year, we will continue our ongoing evaluation of our Sugary Drink campaign. We are also this week and next week conducting focus groups with our priority audience. We're testing possible new messages in focus groups to learn from our priority audience of parents, both in urban and rural communities across our state, in regions with high obesity prevalence. We're also making sure that we hear from parents who say they regularly serve sugary drinks to their little kids. And we'll be creating and sharing these new messages informed by these focus groups this summer and fall. Thank you for inviting me today to talk about Alaska's Physical Activity and Nutrition Program, our Play Every Day campaign, and our evaluation. This campaign really does show the great value of integrating health communication and social marketing into public health programs, and that can lead to positive changes in knowledge, attitudes, and behaviors, and ultimately health outcomes. My name, my phone number, and my email address are on this slide. We also have our campaign website, which is playeveryday.alaska.gov, and the URLs for our Facebook page, Instagram page, and YouTube. Janelle, I'm going to hand it back to you. Thank you.
Great, thank you. I'd like to thank all of our panelists for a really great presentation today. Also want to thank you all in the audience. I've seen all kinds of emotions pop up, so I appreciate your interacting with us. You can still put your questions in the Q&A box, and we're going to move to questions and answers now. So thanks again to our panelists, and let's kick off some questions. So Fran, the first one is for you. Can you describe the new ways companies are marketing sugary drinks to youth?
Well, one of the ways that we're most concerned about is on digital media, as I discussed earlier in this presentation. The really challenging part about measuring exposure is that data are not available. So, for example, the way that we can measure exposure to advertising on TV, there's actually third-party data that gives us numbers. But on digital media, we all know that it's responding to behavior on, when you look for a pair of shoes, the shoes pop up later that you were looking for. We've all experienced that. Well, the marketing is happening to kids in the same way when there's shared spaces on computers, shared time, and any type of behavior might be encouraging or discouraging. We don't know. So we can't get numbers on exposure. What we do see is that food and beverage marketers have really pioneered marketing with some of the best campaigns on digital media, and it's a great concern. So we are, the research community is continuing try to do more to understand it better, understand the effects of it, and I'm hoping that there'll be policies that might be able to restrict some of that.
Thanks for your answer. Yes, my social media thinks I have a young child based on some work we're doing looking at things. My kids are older now. So the next question is for you. What state level data sources are available for added sugar intake or sugar sweetened beverage intake data?
So right now, we don't really have state level data. The ones that we show, we were able to combine some of the national survey that were collected, but due to redesign, they will no longer collect every 5 years. So the data by states are very limited. But one way that we try to collect is using BRFSS. So we're trying to collect the data among others in BRFSS in upcoming years. So that's the only way, but often we only have national data.
Thanks, Soyun. And I would add, we did have some state level data for young children in collaboration with HRSA from the National Survey of Children's Health. think that was one of the articles we shared earlier. So thank
Oh,
you.
yes, thank you. Yes.
And next question is for you. How do public health agencies go about funding successful social marketing campaigns like the one that you shared with us? And what can be done to help sustain those year to year?
Yeah, thanks. That's a great question. Again, I mentioned that Play Every Day has been able to be sustained for 10 years, and that really has come from some innovation inside our team to come up with ways to braid funding from multiple funding sources together. What we've learned over the years is that one grant or one source of funding typically doesn't have enough available dollars in it, or it can't be used for all parts of the social marketing process, everything from focus groups to creation, to placement, to evaluation. But by working together across different programs and different grants, we can braid that together and have it go toward the functions of the process that we need it to. And then as funding fluctuates over the years, we can adjust budgets that way. And that's really been the way that we have been able to continue this campaign. And we've borrowed from that strategy when we have launched new social marketing campaigns for other health promotion issues as well.
Thank you. Fran, if I can direct the question to you, is milk considered a sugary drink?
Well, flavored milk would be considered a sugary drink because it has added sugars. The naturally occurring sugar that is in milk does not put it into a category of sugary drinks. Now, I must add that I am not a registered dietitian, but that is my understanding of the drinks. And we do, even though the report I shared, we looked at other types of children's drinks. In that particular report, we did not look at flavored milks. But when we collect data or do other research and we want to understand a child's sugary drink consumption, we do measure their consumption of flavored milk or parent serving of flavored milk to the child.
I want to acknowledge we got a couple questions in the Q&A about the American Heart Association recommendation for added sugar and it not being totally in sync with the dietary guidelines for Americans. I just would point out that they both recommend that we lower added sugar intake, and then they both recommend that the very young children don't have any added sugars. And as you probably know, the dietary guidelines for Americans, the new committee is in session now and will be having a new edition in 2025. So Yoon, if I can direct this question to you, why did the authors use the greater than 15% of the DGA recommendation as a cutoff for high consumers?
Sure. So it was based on two things. So it was also based on the data distribution and as well as the messaging. So we also have another paper actually published, but it wasn't presented today. So we wanted to have consistent messaging of what is we define as high consumers. So it was 1.5 times higher. In that case, it was 1/3 of youth or adults were falling into the category.
And Anne, the next question is for you. Was there any feedback from families on social and marketing materials that surprised you, like type of messaging or what was more or less effective than your team thought it would be?
Yeah, one of my favorite parts of working the social marketing process is these focus groups. You get parents in the room for a couple hours and you hear just really great stories of their real life experiences, what makes sense to them, what doesn't. I think some of the things, and like I said, we're doing focus groups right now. We just did one 2 nights ago. I'm going to do one tonight again. And we hear that parents are starting to serve sugary drinks at really young ages, sometimes 1, 2, sometimes younger than 1. The common drinks that we're seeing as, you heard the term gateway drinks before, but chocolate flavored milk is a big one. Fruit drinks is the other leading one. I think we hear more and more, and we're exploring new messaging on this front, is the great confusion between what is a fruit drink and what is a fruit juice, and how to tell the difference and how much of even a fruit juice should be consumed. And so these are some of the things that we're exploring. And then, in Francis's great talk, all of these words on these front labels are so confusing to parents. And so a number of our messages. When you go on our website, we have a library of all of our messages we've made for physical activity and for sugary drinks. You're welcome to look through them all, but we've done a lot of work trying to get parents to look beyond the front label where those buzzwords are and to turn the bottle around and look for the includes added sugars line and sort of the truth of what is really in these drinks.
Yeah, Janelle, can I just add to that if you don't mind?
Please do.
It's I kind of alluded to it, but I didn't go into detail. And I'm really not surprised at all by what you're hearing from parents, because I've heard the same thing too. One thing that we just studied is what would happen if you put on the front of package if a product contained added sugars, diet sweeteners, and the percent juice on these children's drink products, the flavor, the sweetened and the unsweetened ones, just in a very simple box. And we found that it really helped parents understand, what was a sugary drink, what wasn't, and it reduced their perceived healthfulness of fruit drinks, which I think is really important. But this is something, again, we're going to be putting in a petition to the FDA for changes. But the industry is really resistant to change because they know how these work. They know that it confuses parents. And so I expect that there'll be a lot of pushback, just as there is with other things happening right now. So it's really frustrating because in a way, it's really transparency of information. It's not really telling people what to do. It's giving people information for them to decide. And I think that's something really everybody could get behind.
Thanks. And I have another question for you, Fran. It says the industry spends money on marketing sugar sweetened beverages and targeting marketing to communities of color. And could you say something on effective and promising strategies to counter that?
Yeah, I mean, the targeted marketing work that we do it's really challenging to for companies to be accountable. What we have found is that we look at the numbers in terms of advertising placement on Black targeted channels, on Spanish language channels, and their reach. And we see that the least healthy foods are put there, very little healthy foods are placed on these types of channels. And then we look at the company statements, and the company statements have lots of statements about caring about the communities, about other DEI initiatives, and they really run counter to what we're seeing where they actually put their money. Because if you cared about the communities that you're serving and that who you're explaining are your best customers, you would market better products instead of picking the least healthy products that you have and placing those on particular channels to reach particular audiences. Shining a light on these practices is important for the research, but we do ask for policies, different types of policies, for media companies to create policies, for example, about the percentage of products that should be need to be healthy, or that there's some sort of standard that's put in place. But it's really hard to get companies to change, and I think we know that frequently is part of the problem is that we companies don't want to change because what's working is bringing them dollars, and they're not really in the business of public health. They're in the business of profit. So I think that we need to put policies in that create a level playing field. Government policies are things that do that, so that one company doesn't lose market share to another if they try to, say, promote healthier products. But if there was a government policy that went across everybody, no one would have to, stick their neck out and lose profits.
Thank you. So we have a couple of data questions. So one, is there any data source for artificially sweetened beverage consumption? And I'll just ask the other one too, and then maybe you can add them together. Were you able at all to look at sugar intake amongst Asian adults?
For the artificial sweeteners, probably enhance could be, but there isn't really data source. So it is only national data that enhance. And the Asian population, they were included as other race group due to the small sample size. We cannot really pull out only their population. But in overall, the other population that include Asian population, their consumption is lower than others.
Thank you. Well, I see we're running to the end of time. So I'd like to thank all our panelists today for a great DNPO seminar series. As I said earlier, this will be on our website. So if you want to go back and watch it again, or you heard something you wanted to think about some more, you can check it out. Our previous seminars are also posted there. We'd like to wrap just a few minutes early because we're the Division of Nutrition, Physical Activity, and Obesity. So I encourage you to take these last couple of minutes to walk around your house, get a few steps in. So thank you again to our panelists, and thank you all for joining us today for the seminar series. Thanks.